My name is Pierre Ouellet. I'm a nurse and orthopedic technician at the Shriners Hospitals for Children, Canada. Today we will demonstrate how to use a fiberglass brace to temporarily immobilize a fracture. Dominique will be my patient today. The toolkit, which we will show you today, has a lot in it. So we have a 3 inches wide per 35 inches long fiberglass brace. We have orthopedic cotton wool, which we won't use in this particular case. We have elastic bandages. We have cohesive and flexible bandages. We have a pair of scissors and an aluminum brace, which we won't use either for this demonstration. There is a bone stress ball as well. At first, we will measure the brace, which we will use on the patient in order to see the part we will need to immobilize the femur. So we open the package, and here is our brace. So what we will do is a brace which will immobilize the femur, and as we can see it, I will not need to cut it. The brace as is will suit him full length. The second step on this brace is a foamy part, which has to be in contact with the skin, and we see the fiberglass through it. So the way I will show you to dampen it in order to start the chemical reaction so it hardens, there are multiple ways. Some open it and dampen it directly, so the easiest way is the following. We use lukewarm to lukewarm cold water, never hot water. To have it lukewarm is for the patient's comfort. You have to know that the warmer the water, the quicker the chemical reaction processes, so the quicker the brace hardens. This is really important. From the moment we dampen the brace, we have 3 minutes to apply it. It will harden in 3 minutes. So we quickly run it under water like so. No need to take much time here. The minute there is a bit of water in it, like so, the chemical reaction has started. So what we do is we remove the excess water so the patient is not so soaked. Now, when a patient has a fractured femur, we have to consider that it will be painful. The moment we will move the patient, they will show pain. So we go slowly. We can even ask the patient for help. And slowly, I insert the brace underneath the patient. All right, then. Let your foot straight. Up to under the buttock. Are you able to turn a little? Now, if we ask the patient to turn, they will be in a lot of pain for sure, but we have no choice. We have to insert the brace underneath the patient. So I will start rolling at the foot with the elastic bandage. So we can stop here at the toe's base. That's enough for this type of immobilization. I will never compress these sides here for the sole reason that the folds can create pressure points which will injure the patient. Now our patient is really tolerant, as you could see. But I could tell you from experience that when we roll an elastic bandage like that, the patient is in pain. It is even really painful usually. We absolutely have to immobilize the patient, otherwise it will be worse. If the patient is tall, you could use the cohesive and flexible bandage, which is larger, so it installs really well. You're better off unrolling it prior to applying it. To use the natural curves, like under the knees, is a good idea as well. So we unroll. We run it underneath the knee, and we could tie it after. We should be able to go at the highest possible point with our bandage. If the patient is in a lot of pain, you could stop here at the thigh, will be enough.
Ici à la cuisse, ça va être suffisant. Ce que j'aurais le goût de vous rajouter comme explication de cette attelle-là.
What I would like to add is that when you finish the brace, that's the moment to position the patient the way you want them immobilized. So ideally, the foot is at a 90 degrees angle. We could add a little cushion under the knee, depending on the patient's level of pain.
Mais ça, c'est en fonction de la douleur du patient. Et puis, on attend là, que ça
Now we wait until it hardens.
3-5 minutes.
It could take 3 to 6 minutes. I had used quite cold water, so it could take 5 minutes. Now what I was about to explain is, the reason we hold the foot is that we want to prevent it to fall towards one side or the other, which could cause a torsion in the femur. That's really important. The other thing is, the fact we bandage up to underneath the buttock will prevent this rotation as well. If we had stopped the brace before the buttock, we do not prevent this rotation.
On ne prévient pas cette rotation-là. Donc, celle-là, elle est très, très importante. Si on est capable
So if we're able to slide the brace underneath the buttock, that's a way of making sure the leg will stay straight, and that makes a big difference in the patient's comfort. A femur which is not in torsion will generate much less pain than a femur which can be in torsion.
moins de douleur que celui qui peut avoir ce mouvement-là. Donc, c'est très important de mentionner.
It is important to mention that this is a temporary brace. It should not stay on for weeks.
Demeurer une semaine, 2 semaines, 3 semaines. Ceci est fait de façon à soulager le.
Its aim is to relieve the patient during the transportation to the hospital, so that brace is not a permanent one. It is a temporary one.
Elle est faite de façon temporaire.
Once the brace is installed, it is important to monitor the neurovascular symptoms.
Les symptômes neurovasculaires. Donc, dans un premier temps,
First, the toes must be colored, so neither blue nor white. The patient must feel them, so you can ask the patient whether they feel their toes or not.
donc vous pouvez demander au patient s'il sent bien ses orteils. Ensuite de ça,
Then they have to be able to move them. Are you able to move your toes? Thank you. So these are all important things.
des choses qui sont importantes. Si jamais le patient
If the patient ever complains that their toes feel numb, or if the toes become cold, these are all signs that our bandage is too tight and that we need to loosen it.
sur notre attelle est trop serré, va falloir le relâcher. On peut, une fois que l'attelle est faite,
Once the brace is hardened, like it is the case here, we can keep it in the future because it'll work as long as the child does not grow too much.
pas trop.